Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist. So, very often I get asked by patients and relatives who are diagnosed with cancer as to who is the best possible person to treat my cancer or treat my relative's cancer. Now, let me just go through this. Now, there are many people who are equally competent to deal with a certain cancer. Like, say, for a cancer within the abdomen, say a cancer of the stomach, there may be surgical oncologists, there may be surgical gastroenterologists, and even certain general surgeons, all who are adequately trained to perform this type of surgery. So, how does a patient decide as to who is the best possible person to deal with his cancer? Most of them do tend to search on the internet, but we must realize that the internet is a fallacious thing. We know that reviews and ratings may not be the best possible way to judge a surgeon. Many senior surgeons that I know are averse to the internet and do not really solicit their patients to put good reviews, and sometimes some surgeons are outright about things to the patient. Though they are honest, they are outright, and this may not be liked by the patients who go on and write bad reviews about the surgeon. So, how does one decide? I cannot tell you who is the best possible person, but I can tell you what are the general principles which one must follow before any type of surgery, so that you can be aware that the doctor has done the best possible thing for the management of the cancer. Now, certain things which will help you to judge the surgeon or the treating oncologist is that, has the doctor explained to you the diagnosis properly? The diagnosis sometimes may not be straightforward. Very often I get ladies with a breast lump, which sometimes is difficult to tell whether it is malignant or benign, and we may have to rely on further investigations like a frozen section. So first and important thing, the diagnosis should be explained to the patients and relatives in detail, and if we have not arrived at a proper diagnosis, this also should be explained to the patient. The second thing is staging. You have to be assured that the doctor, before treating you, has adequately staged the disease. That is, the necessary investigation like a PET scan or a CT scan has been done. Except barring a few exceptions, normally it would be wrong to take a patient for treatment without adequately staging it. Next, always see if the doctor has explained to you about the overall plan of treatment and not just his part. What I mean is that, see, certain cancers, like say a rectal cancer, they may need chemotherapy following surgery or radiation following surgery. Has this been explained to you? Or has the doctor been just explaining about his part or the surgical aspects? It is very important that the patient understands the overall plan of treatment rather than only surgery, so that he can be prepared for the finances, for how he needs to plan his next few months. The other important thing is that, has there been a good coordination between the three specialties: surgical, medical, and radiation? Many cancers nowadays are not operated upon directly. There may be an indication to give neoadjuvant or chemotherapy and radiation before surgery. Now, has the doctor explained to you whether it is required, whether it needs to be done, and if it is not to be done, why it need not be done? So, please check with your doctor, or please trust a doctor who tells you that it needs to go for chemotherapy and radiation prior to surgery, and if not, why it is not required. So, coordination between the different specialties, medical, surgical, and radiation, is very important. The other thing which you need to know, especially from your surgeon if you are undergoing a cancer surgery, is this suitable for a minimally invasive treatment, like laparoscopic or robotic? Nowadays, in the last few months, the laparoscopic and robotic surgery has come up in a big way. And it would be a must to discuss with patients whether a certain cancer can be dealt better by doing it laparoscopically or robotically. Again, I would like to stress that not all cancers are suited to do by this method. Certain more advanced cancers are those with doubtful resectability. The traditional method or the open method may be the best method for treatment. But if the cancer is suitable, the choice of minimally invasive surgery, that is laparoscopic or robotic, has to be offered or has to be discussed with the patient. And if it is not suitable, the doctor should explain to you why it is not suitable, whether he thinks that the tumor is too big or whether he thinks that the patient is not suitable. Certain patients with cardiac problems, they may not be suited for a long laparoscopic procedure in which the abdomen is distended. The next important thing is whether all the complications have been explained. Very often we see that surgeons try to underplay the complications with fearing that the patients might lose out or go to some other this one. Do not take explanation of complications as a weakness. All good doctors do explain all the complications to their patients and tell what is the percentage of chances of it happening. It is impossible to tell whether a particular patient will end up in a complication or not. But the averages can be told. What is the general? Is it 5%? Is it 10%? Is it 20%? So this percentage needs to be explained so that the patient can take an educated decision. So overall, there are many doctors who perform a surgery in an equally competent way. Please see if these following principles have been followed in your treatment or your relative's treatment. The place where the surgery is performed is also important because no doctor can handle the patient on his own. He will need the help of the ICU specialists, of cardiologists or pulmonologists. Especially if it is a high-risk patient with multiple comorbidities, it is very important that all these other specialties are available. Also, there are what we call as comprehensive cancer centers, where all three modalities, surgery, chemotherapy and radiation, are available under one roof. The advantages of having all three modalities under one roof is that the coordination is better between the different specialties. So the patient can seamlessly coordinate between the chemotherapy doctor and the surgeon and the radiation oncologist depending on what is the treatment to be followed. This may not be possible if the cancer is treated outside a comprehensive cancer center. Coordination is possible, but it will have to be done in different centers. So please keep these factors in mind before deciding where to take treatment under whom to take treatment for a particular cancer patient. Thank you.